Pregnancy Made Easy, a journey to new discovery. I am your host for today. My name is Dawn. I'm also known as That Mom of Four. So for those of you who are meeting me for the first time, I'm Dawn Sen, right? And if I'm meeting you again, hello again, right? So I'm a mom of four. I do have four daughters. I'm an entrepreneur. I'm also quite active on social media. And with me today, we do have our expert, Dr. Wong Boh Boi. I'm sure she's a very familiar face to many of you. She's a very familiar face to me as well. Okay, so she's the founder of Wong Boh Boi Private Limited and a senior Parentcraft consultant, right? So if you guys want to find out more about her, you can also go to her website at wongbb.com, all right? So here are all her accreditations. So many, right? Okay, but very importantly, she's going to be our speaker tonight and she's going to answer your burning questions. She's an international keynote speaker as well. So if you have any questions about pregnancy, please put them into the Q&A box right at the bottom, right? So we'll pick those questions and we'll answer them at the end of today's webinar. All right, over to you, Dr. Wong.
Hi. Yeah, thanks, Dawn, for the introduction. And very important today, actually, Boy. I'm very happy to be able to share with you whatever you want to know today, everything you want to know about pregnancy makes easy, a new discovery. It's a very big topic. So therefore, I'll narrow it down to mental, physical, and emotional health in pregnancy. And mental uncertainty. There is a lot of uncertainty about pregnancy outcome, and physical discomfort related to pregnancy, possible complication after childbirth. Emotional, there's a lot of fear, anxiety, mood swings, not knowing what to do. So mood swing is something that usually the fathers will share with me. The husband, I used to run the father's boot camp. Now, prenatally, a lot of mothers not only asking me about concern over the pregnancy, most of them ask me, it's about relation to breastfeeding. And they always ask me, what should I do before delivery? Breastfeeding or bottle feeding? Insufficient milk supply to meet my baby's needs. Should I, eat traditional food or normal food? And will I get nipple soreness and engorgement? And how to get optimal techniques? I only can advise you. Breastfeeding is a big challenging journey. Up to date in the world, the prevalence is actually 96% of mothers living hospital breastfeeding. By the end, halfway through, only about 20 to 30% of mothers exclusively breastfeeding. So always remember, in order to breastfeeding, we must always bear in mind 3 factors. Start right. So holding baby in years of experience is a support. So you create stability and proximity, and also what we call the bonding, and you can see better. Always remember, second point, which we want to talk, is always support your breast far away from areola. When baby latch on deep latch, then you can hear swallow sound. So I suppose, breastfeeding is our next topic. So today I just want to tell you, if you deep latch, well, you will not have breastfeeding problems.
Yeah, I just want to jump in here and just remind everybody who's here that tomorrow we do have a topic. All right, so the next webinar that we have tomorrow is actually on breastfeeding. All right, so if that's something that you're keen to learn more about, please make sure that you are registering or you've already registered for tomorrow's webinar. Right? Sorry, Dr. Wong, back to you.
Yeah. Okay. Mother also asked me, how can make my husband be involved in my pregnancy? Yes. Husband play a very vital role as an encourager. You're also very important a motivator. You motivate her, you cheer her along, and just being there. So it's a form of like protector. You're actually helping her. So in the class, I often give father tips how to take care of the mother in a simple manner. Even do a bit, even you're watching news or whatever, you can do a bit massage for her arms, because this arm is very important. She had to, once the baby is born, she had to carry baby very often to her to nurse that baby. So this arm, if the technique is not actually done correctly, it can lead to carpal tunnel syndrome. So simple massage, and also help her to release, cope in labor. Some of the acute pressure points the father can use and learn from the class to apply to help her to release that little bit of discomfort. All right, what we call the labor contraction pain. And very important, and help her to relax, and like stiff neck, mother breastfeeding always like that. So therefore, it can affect the lactation. So relax her a bit, that is vital. And very important too, that the father in the class must learn to bond with the baby, right from what we call prenatal session. Right, what we call Tai Chiao. So I started Tai Chiao many years ago. I have helped 500,000 of parents in my life. So learn to communicate, touch that tummy of your wife, and by touching indirectly into your baby. And then understand what is called music. Can be internal, can be external. And also preparation of baby coming out into this world, called associating with, with light in the world, because the womb is very dark. Should a mother or father able to learn the 4 approaches when baby is out? Research has shown baby is very alert, very interactive, and very, responding, and last, receptive, listening skill. I used to help out in school before. If the child is born very clever, but don't have a listening skill, may not do so well in school. So again, he will learn to master what we call involvement in baby care. Let the mother concentrate on breastfeeding. So even simple things like burping, changing diaper. I often found Papa doesn't know how to burp baby. And they follow some people's own method, stroking outwards, which will lead to Merlion's effect. All right. So there is a lot of method father have shown me in the class. Actually, it's not so effective. So coming to learn the technique, it means a lot. Identify baby's various cry. Baby cry is a needs. So by looking at the facial expression and the tone of the cry, and also the body action, then the father will pick up some cue what my baby's, actually asking for. And rather than get frantic, frightened, and keep, jumping over the place. So sometimes learn to be calm and never react. That's what the keyword in the class for. Learn to settle baby to sleep. That is another major problem. I often get that. And also they ask me a lot about pees and poos and vomit. So my job, because it's clinician, I actually see a lot of these pee and poos. So as I say, at the end, they can ask me questions, whatever they want.
Thank you. I just want to say that, for those of you who are still preparing for your first one to come out, please just go for those courses first, because once your baby comes out, there's no time to go for this course already. So yeah, go find out sooner.
Yeah, you're right, Dawn. So it's make use of the first pregnancy. And second trimester is the best to start, like 20 weeks pregnant. You still got plenty of time. You can revise, you can practice. Then when baby's born, you can implement. That is what we want. Able to apply what you learn and then onto the real baby. That's why I also have classes for that. And parents find it very, very useful. They have learned the theory and the practical, and now they apply on the real baby. Okay, and next I want to talk about changes to your body in pregnancy. A lot of mothers, worry a lot about changes. And I assure you, now distribution of the weight, baby at times roughly 3.2 to 3.6. Of course, other babies can vary a little bit. Fat store 2.7 to 3.6 is very important because you need fat. Otherwise, when your mature milk comes in about 10 days, you don't have fat. Your high milk will be not quite full of fat. Baby need fat to grow and well-being. Increase in blood volume by 1.4 to 1.8, and then very extravascular fluid volume also increase in 0.9 to 1.4. Amniotic fluids, do you know that it's about roughly almost 1 kg. Placenta, all right, 0.7. The biggest baby ever come from my class, the placenta was 1.2, all right? So you can see the baby was 5.7 kg.
Oh my goodness, was it natural?
Yeah, amazing, right? Actual breast tissue. This is something every mother asks me, Dawn. And they ask me, by nature, 15 years old that day plus 3 months, your breast cup size is fully confirmed. But nature is very kind to you. As soon as you're diagnosed pregnant, you're given a second chance. Correct. And there's extra breast tissue meant to stay even after you're breastfeeding. Stop breastfeeding. So learn how to take care of that gift itself. Total weight gain, 10 to 14 kg. I can warranty you almost all mother after delivery, 6 to 8 weeks, back to normal again. Some mother even lost back to thinner than before that she was pregnant because of breastfeeding. Okay. At the same time, very important, if you put on 5 kg on top of that, that extra 5 kg may take up to 6 months to lose. If you put on another 5 kg, Dawn, it will take up to 2 years. Then it's the second child. So you never lose any weight.
Yeah, so just manage your weight during the pregnancy.
Right, you're very lucky, you're very slim. So, posture can be affected because there is increased stress on your thoracic spine, all right? And also the joints and the soft tissue because the progesterone relaxing hormone, it affects every bit of your ligament, muscle, and your joint during pregnancy. Balance changes, ribs flare, uric page flares up, and later stages, and also your thorax widen up, and fetus pushes, this baby pushes onto your diaphragm. It makes you very uncomfortable. Some other, the weight is all in front, can you remember? So some other automatically alter posture and become an S shape, which is actually not too good for your lower back.
Yep. So many mommies have back pain during pregnancy. It's not funny.
Correct. You're right there. Next, weakening of pelvic floor is mother always whisper in my ear. If I have a vaginal birth, my mom say inside out will go loose.
Is that true?
Very frightened. I say, no dear, no dear. All right. Although by anatomy, there is weakening of pelvic floor. Pelvic floor refers to layers of muscle that attach. Can you see? Right?
Yeah.
Okay. So you can see a diagonal section of it, the support weight of the abdominal organs and the weight of the growing baby. So your baby actually growing very fast. Okay, and can stretch and weaken during pregnancy, not only childbirth, but this tone may be maintained and restored by simple secret, what we call pelvic floor exercise.
Yeah.
So uterus will normally return back to normal. After delivery, your uterus is roughly about this size,
Whoa.
You have to go back to that size. So maybe mother will after pain, but I say to mom, well, you take some painkillers, your doctor will prescribe for you, your ONG is taking care of you, nothing to worry about. So we are there to support you and then to help you and guide you. That's all.
Do women have very big differences like in the duration of time that's taken for ovulation?
6 to 8 weeks average. So unless there is something like complication sets in, which actually will take aside because it's a big topic, and then sometimes they got a bit of retained products. Otherwise, if mother got retained products from the placenta, like little bit of tissue, she'll have bulky, uterus, and then 10 days later, she had likely to have secondary, what we call infection. So she may bleed. So, no need to worry about it. Your doctor is doing a good job. So the midwife have to check your placenta. So it's very rare. It can happen. But of course, it does happen, sometimes. Okay? Yeah. Right. So very important nature, will involute. And from this size, the involution will take place. And then it go back to original size of your fist. But be caution. Sometimes certain exercise, you overstretch yourself, it can lead to what we call recti diathesis. That means your abdomen, the two recti, your abs open up to allow the baby to grow. But after delivery, these two abs must close back, zip back. So again, doctor give you allowances about 6 to 8 weeks. But you overstretch it by doing the wrong exercise, it can cause more damage than good. And symphysis pelvic, and it's something that we also need to look at.
Yeah, I had it for my third and fourth child, and it was so painful. I couldn't get out of my bed. I couldn't get out of the car without feeling so much pain.
Correct. See, Dawn. All right. This is your very important, the soft bones. It become, widen too much. So it affect your guidance itself. So mother will have even urination, and then the pain can be there, and it radiate from suprapelvic all the way to the back. And you can't even turn in bed, and it affect it can happen during pregnancy, even more common after childbirth. So again, learning how to squat in the class with the correct technique, it helps to prevent a lot. So we actually do a lot of conservative treatment and prevention rather than a surgical involvement.
Oh, lovely.
Yeah. Now, how to exercise, Dawn? I know a lot of people out there create program, but again, exercise during pregnancy, you have to be very mindful. All right, especially like condition, doctor mentioned, like low-lying placenta, you have history of premature labor, or you have multiple pregnancy, or you have very short cervix, or you have incompetent cervix. All this doctor will warn you before. Your ONG take care of you, and ONG say to you, oh, certain exercise, stretching exercise, please do not do down below. Okay, let's talk about exercise. In my class, moving around safely, I always encourage one daddy in the class, volunteer, to don a pregnancy jacket, about 20 weeks pregnant, and then he'll perform daily activities, even like getting in and out of bed, or even, like learn to squat in the squatting toilet, which Asia have, squatting toilet.
Yeah.
Not how difficult it is to squat when you're actually pregnant. So after that, he will share the experience, how he felt like to be pregnant for 3 minutes.
Wow.
So that is important. Then you can see the picture, actually is Papa, it's not Mama.
How heavy is that? How heavy is that stomach, Dr. Wong?
Can be 5 kg weight in front. So that's why, although the baby is very small, about 350 grams or up to about 450, but it's a lot extra activities.
Wow.
And then, it's quite uncomfortable itself. So most of the men are very strong and very healthy. So they will often say to me, I got backache, I got shoulder ache, I got groin pain over the groin because of the weight sitting over there.
Yep. Well, I wish more classes would involve fathers like that.
Every class involved, right from massage, simple massage for mommy to actually experience. Then they only can tell how you feel like as a pregnant woman.
Yeah, they should definitely join in. And if you guys have questions, if you came in a bit later, you join us a bit later, and you have questions that you want to ask, please put it into the Q&A box, okay? Because that's where Dr. Wong, our expert for today, our baby whisperer, is going to be able to help you, just get rid of all those queries that you have, the doubts that you have as well.
Yep. So later on, we answer all the questions. And next, I want to talk about is very important. Always remember, walking is also a form of exercise. I always encourage, you probably swim a lot as well, Dawn. You can do daily activity. Yeah. So, rest as much as you can. Whenever you need to, put your feet up. Enjoy a little bit of comedy show, or just have a chit chat with your husband, let him massage your legs and your back a little bit. And you make the time before going to bed, share a little bit of heart-to-heart talks before you go to bed. All right, that is your daily activity. Next, I want to talk about is low impact exercise. A lot of mothers believe that when I exercise, I can do vigorous exercise. Ideally not. Research paper, mine is all evidence-based. You see little note down below is actually the references. Right, for research, because I believe in whatever you learn, you must be medical evidence-based rather than hand-me-down knowledge.
Please don't just go and read information from the internet, okay? So make sure right sources.
So that's why I say to mom, don't do cardiac exercise. It increases your heart rate, it affects the oxygen go to your baby in the womb. All right, avoid breathlessness. When you exercise, you should not be breathless. And you should not have profuse sweating, because by nature, when your temperature reaches 38.5, medically we call it, fever. Nature makes you sweat to cool down. So when you do exercise, pregnancy, you should not have profuse sweating, and you should not have severe pain. So duration is good to break it off. Well, 1 hour, every 15 minutes, have a little break, then continue again, and then gradually build it up. And further, your involvement in exercise. Again, as a partner, you can help her to release, learn in the class how to release some congestion. So you see, I'm showing Papa how to release mother for her, indigestion and, breathlessness. And sometimes, the baby is pushing up. So the mother feel very full. And then when you lie down, you won't feel like throwing out this, and you feel breathless. So certain tips like learning is important. And the exercise is cater to take care of your posture all the time, as much.
So true, yeah, doctor. I can't emphasize that enough, because I'm also into fitness. So I do actually conduct classes for prenatal ladies and postnatal as well. And those who stay active, they have so much less complaints after they give birth, and they have more energy to help look after a growing baby as well. But just one question, is it possible for certain exercises? Do you teach certain things in your classes that can help with like the indigestion or the acid reflux? Because that's a very common thing that people experience, right? And then that put them off wanting to exercise.
Yeah, so correct exercise help you to feel getting better and for the better well-being. Most mother, as I say, as your pregnancy, especially nearer to the late pregnancy, the whole congestion is there. Besides congestion, reflux, and then discomfort, acid burn, heartburn, we call, is also frequent urination. They also got a lot of problems there. I do tackle a lot of this question in the classes as well.
Yeah.
Later on, I can answer some of the questions if you like to ask me. Pelvic floor exercise, I have a secret, reverse muscle control exercise, beside Kegel exercise. This exercise, based on the feedback for previous clients, should they bump into me, they normally hug me and then whisper in my ear, don't forget to teach that special exercise to make sure the birth canal is back to tip-top condition, even after 5 kids. Well, that one I haven't shared in the world yet, but that I still keep it a secret for.
You're gonna go for your course. I think I want to go for your course. I'm not gonna have any more children, but I still want to go for your course.
Yeah, you have to learn, because it's actually based on feedback. Like even after 5 kids, mom, should they bump into me? That is a truth, the feedback, which that's why I get. As I say, I'm very happy to be able to go to town and even shopping mall or even supermarket, and people come forward and hug me. That's my rewards.
Oh, I would totally hug you when I see you on the street as well.
Yeah. Oh, thank you, Dawn. That's my reward. I feel very, very encouraged when the husband hug me, on the street, and then even in the NTUC, then people look at me and then he just want to thank me, what he has gone through, and then he used the skill for the subsequent deliveries and so on.
Yeah, but I think those are the ones that actually have gone through like trauma already, and then they finally found you to help. So don't go through the trauma, just go through the prevention is better than cure.
You're right, because we have to learn, I emphasize a lot of prevention. There are some common complications. Today, I cannot cover all. Your ONG will actually able to explain a lot to you. So common complication during pregnancy is very common. Constipation, hemorrhoids, reflux, like you asked me just now, indigestion, leg cramps, and increased urinary frequency, stretch marks, backache, muscle aches. Of course, there is other medical, because I teach antenatal class. Being a clinician from UK, all right, I handheld the nursing students, the midwives, and the young medical students through the learning journey. So actually, I'm also a writer of all obstetric books and some of the obstetric, childcare, breastfeeding, and also I co-write with other doctors as well. So preterm delivery, often sometimes they ask a doctor and they say, doctor, don't have the time, can I ask you more? By all means, we work as a team. Medical side work as a team. We want at the end, it's a healthy mother and a healthy baby. There's no competition in the world. Our main objective is a healthy mother and happy father and a healthy baby. Right?
Happy family.
Correct. Hypertensive is very common as well, gestational diabetic. So if you want to ask me a question, please go ahead.
And
right.
actually, a lot of these conditions are preventable. Isn't it?
Yes, it's all can be prevented. Simple, management, and then we're able to sit down and say, use this technique, approach, or whatever. Even, sometimes mothers say, I got actually simple like stretch mark. Do you have stretch mark?
I don't have any
concern,
except for, I don't have except for one on my boob. That was the only one. That's the only one that I have. I'm not sure if it was because my stomach didn't grow very much. I only put on 7 kilos.
Well.
Yeah.
If it's growing well, we're not concerned either, Dawn.
Yeah, they come out about 3 kg.
Just lucky one, right?
No,
Stretch mark is very common because your derma, the second layer, is overstretched.
Yeah.
All right. And because of that, it broken into pieces. So this little vein floating about can be purple color, can be blue. It's so colorful about it.
Yeah.
Okay.
Yeah. So yes, thank you so much, Dr. Wong, for putting in all the slides, and it's so informative. I'm sure there are so many burning questions. Let me see. We have like over 68 questions, but you know what? We're not going to answer all of them now. Okay, so we're going to pick out just a few of these, and just we're going to start off with the first one, right? So somebody asked us between natural birth and C-sections, right? How do we decide which route to take, right? And if it's so whether or not somebody should go for a C-section or natural.
I will advocate natural childbirth. When a mother go into natural childbirth, down below have create a natural immunity for the baby. That's the first line of our advocation of why we have to go for natural childbirth. I know there's a lot of discomfort, pain to cope with, but there are a lot of technique. In the class, you learn to cope naturally using breathing technique. And sometimes we also got medication, which your doctor can prescribe and to help you to go through. Popular one now is epidural, okay? And at the same time, very important is a fear. You know that I want to show you something, if allow me to do that, because your baby, mother always concerned vaginal birth, how baby come about. This is your pelvic. And when you're actually pregnant and you're in the maneuver of the baby go down after 38 weeks. After they go down, then when there's contraction push the baby further down. So further go contraction, further descend, and the baby hit the pelvic floor. That's why you got to strengthen your pelvic floor. Internal rotation take place, further go contraction, further descend, and the baby flexes head. No silly baby will actually look up like that. They actually flex the head to make sure the presenting part small. So you don't feel so much, discomfort. After that, baby further descend until you can see the visible size. So this is important. That is called you're fully dilated. So the baby already go through the sacral region. And the coccyx automatically, straighten out. And then nurse will get you to push, the doctor will be there, push and push until crowning. Able to cooperate as a team with the midwives and your doctor means a lot. And then to get the intact perineum to avoid, of course, before we do the stretching exercise during antenatal period, we also do another technique by able to cooperate with the doctor and you pant. Baby is out. So you give you intact perineum as much as we can. Imagine rewind, right? Your baby out already. No such thing as rewind. But here I can show you rewind. Like imagine you never been to a proper class and doctor say stop, midwife say stop, almighty. Of course, you have a bit of chair. You understand? So proper classes, understanding, it make a lot different. Of course, head is out, posterior shoulder rotate, hit the pelvic floor, and then the baby rotate, and the baby head will be in line. No silly baby will turn this way, so you no need to worry. And then the anterior shoulder is born, and the whole body come out to the mother's abdomen. How easy is all over.
Yeah.
So I just want to assure you.
You made it look so easy.
Yeah, it's very easy. And cesarean section, another reason why doctor asked for it is because there is complication. Then we need to get the baby, maybe early complication that mother got preeclampsia, where either the doctor induce you or to perform emergency C-section. There is a concern about medically. So baby like fetal distress are not growing or whatever. So let your doctor, worry about it and share with you.
Yeah.
Rather than jump to conclusion, I don't want pain, I don't want my birth canal to be stretched, I want elective cesarean section. But we also must be respectful of people who actually want that. But of course, I give them informed choices. And that is important. So we sit down and discuss, and then I say, you talk to your doctor, I already discussed with you. It's so easy, you see, right? You can have other things to help you to cope in labor. Your husband's there.
I think you raised a very good point. It's just making a very informed decision. But for many parents, like, they don't source the information as much, and then they just make a quick decision just like that. So I think that preparation part is so very important, and it's something that we probably didn't have as much in the past. But now we have experts like yourself to shed a lot of light and just give us all the options and the information that we need, so that then you can make the best decision for yourself. But something that you showed just now, where the baby was coming out from the birth canal, right? Is that when the pubic symphysis happens?
Yes, sometimes, because if you do not push it correctly and you never prepare antenatally how to squat properly to actually flex that, symphysis pubic in the correct manner. So there are a lot of methods doctor will adopt, but as I say, preparation antenatally, how to stretch it gradually, rather than that moment try to stretch it.
Yeah.
Your legs, your position, actually there are many methods. So learn and discuss, and then we know your doctor well. Your doctor is the best person to take care of. As long as your doctor is comfortable after discussion, and then you're able to have a choice of methods of delivery.
Correct. Yeah. Because you were mentioning that there were some massages that you can do, right? To prepare the skin.
Perineum.
But so the pubic symphysis happens when it's like the connective tissue, right? Around the
down below, there is a stretching. It can stretch. And then there is, beside massage, there's Epinol, and other doctor will use it, but it's fine. But most of the mother, I say to you, with first baby, not been stretched before, the perineum, the thin skin, there's the anus, there's the perineum, and can tear. So your doctor is concerned. So antenatal preparation, by doing the massaging, it can help to stretch a little bit, just sufficient enough to, keep an intact perineum, but don't overstretch.
Okay, so those of you who are getting ready to, so how soon in advance for those who are pregnant?
Normally, perineal massage, I will ask them to do it after 36 weeks.
After 36 weeks. Oh, okay. So probably not too late for most of you guys.
And don't do it too early. And because if also there is a technique, and also there is a hygiene involved, and do it right.
Cool. So in like you just mentioned about massage, right? What about the rest of the body? Somebody was asking, can she go for massage, and is it recommended?
Well, massage is good for you, relax you, but massage, by some of the times, I always say to mom, if you got very sensitive uterus, and massage your tummy, ideally not too good. And massage your breast, nipple twiddling and playing can be a form of natural induction of birth. Same with long walking and frequent sex as well. So therefore, we have to be individual. We have to check through, is your uterus very sensitive or is normal? So again, you must choose somebody who is well-versed in A&P, anatomy and physiology, rather than anyhow blind, massage here, massage there. And sometimes even the foot of a mother, if you don't massage correctly, you touch the heel, there is a sciatica there. It can actually affect. So again, go for very, very expert people and well-trained, and not just hand-me-down.
Okay. Thank you, Dr. Wong. I think, those who are, because moms are already like, wow, so tired. It's like the whole body's in pain most of the time. So I'm sure everybody's thinking about a massage, but yeah, so there are qualified individuals who can do that for you. Just make sure that you're not just anyhow walking into a massage parlor and I just want to get a massage. So yeah, there we go. All right, next question that we have, somebody was asking, is it advisable for a husband to help the wife to suckle if she's in pain? So that she's heard that there are two very divided groups on this. To help the wife to suckle if she's in pain.
Suckle, she's in pain. Are you talking about the contraction, or are you talking about breastfeeding?
Sounds, it looks to me like it's breastfeeding.
Oh, breastfeeding. Actually, I got a feeling she's referring to engorgement.
Engorgement.
Yeah. Sometimes mother, engorgement and sore nipple and all those complications, purely you do not latch well. If you latch well, position right, deep latch, baby, am able to effectively empty your breast, it will not come into this stage. Yes, father can help, but it depends on your husband. Please be respectful of what his thought is. He may want to help you, but it can put him off. Some men discuss with me as I have a boot camp. They say, first child really put him off, having to suckle on the milk. And you put him off drinking milk after that.
Oh no.
So, be frank, be open, you're two together, he's there for you. And whatever question, you can always ask him. There's no barrier between you two.
Yeah.
That's how you give birth to your baby.
Yeah,
right?
and that's an opportunity.
You cannot ask your husband.
Yeah.
Be frank. Rather than say, hey, 老公, come and suck on my breast. It may not feel comfortable, and yet he cannot say no to you, and it can make him feel very awkward.
Yeah. Oh, well, I believe that it's definitely got to be engorgement, because I had engorgement before as well. But then I used breast pumps and I had to squeeze and massage in order to. Yeah, but I think with the techniques that you said, there's massage techniques as well that can help the mommy. I think that can to a certain extent also help to prevent the engorgement, right?
Yep. Very important when you massage, there is a special technique. Don't anyhow squeeze. Breast is made of grapes. When you squeeze a grape, there are branches of grapes. Then they become flattened, then become raisins. Then you will not have milk anymore. You may get one moment squirting milk, after that all collapse already. So again, you have to come and learn the special technique. It should not be painful and squeeze less crazy. You cause a lot of damage, tissue damage, and you collapse the alveolar cells. So be mindful. I understand how painful it is, but the correct approach is important.
Can that actually cause permanent damage and then affect the subsequent?
Good question, Dawn. A lot of mother, after being cleared one time by somebody, like a Matsu, after that, come to me and say, no more milk. She said that they got a lot of milk, they squeeze until very painful. I cry and it all bruised. Then after that, no more milk. Yes, I have feedback on that. We're all out as a lactation consultant in this world. I'm a lactation consultant for one of the earliest group. And we actually work together, and we have to develop things that is not to let mother suffer. Engorgement start right, on the right foot. And then if need to, I have a technique I can share in the class or whatever. But today you cannot because it's public.
Yeah, I just want to tell all of you, I've posted with Dr. Wong before, and the last time that we did the webinar was about breastfeeding. So there is so much. She's like an encyclopedia when it comes to breastfeeding. So if you have any questions, or if you are planning for breastfeeding, or if you're experiencing any breastfeeding issues, she's the person to go look for.
Thank you, Dawn. I think we all share the same objective. We want to make you better and prolong breastfeeding, and try to be as much as we can. Best for the baby.
Yes, best for the family.
Breastfed your kid, right? I breastfed my both kids.
Yeah.
1 year each.
1 year each. Same.
But I'm a full-time worker like you. When I never take leave, and yet, to be honest, in my whole life in UK breastfeeding, I never got problem.
Wow.
Maybe I have the right approach, maybe. And a mindset.
For sure, yeah. I think the knowledge is definitely going to make you so much happier as a mom. And then, parenting, I think, shouldn't be such a torture, right? But it's really about knowing more avenues of what can help you. So it shouldn't always be that one way or no way. So just go ahead and speak to the experts. And for those of you who still don't know where to find Dr. Wong, is at wongbb.com. Okay, very easy to remember.
Thank you. But father, don't forget you are there. You're the main supporter.
Yeah.
The research also shown that father's role also important in breastfeeding. You got the breast, but it's not suitable for breastfeeding. But your role is number one.
Yeah, support. Okay, thank you, Dr. Wong. Now, next question that we have is what are some good things to start learning before the first child is out? I guess it's most important things to learn.
Most important thing is actually be clear and very informative and understand the knowledge of childbirth. And think of the complication, uncertainties, certain times it can occur. When it occurs, how to manage, you have to work with your doctor. And let's be frank, your doctors are experts, not anybody else, your ONG. And then if the baby is born, there is a group of us there. Of course, you got your specialist pediatrician and your neonatologist. They're out there to support you too. It's a teamwork. So be mentally prepared, every resources in place, and understand what's happening to your body. Listen to your own body.
Yeah.
Share with your partner.
Yes, just make it an opportunity for you to have a stronger bond as well. It shouldn't be, a lot of people, I hear a lot of people say when the baby comes along, wow, then the couple time is gone and things like that. But there's still a lot that they can do together, right?
Yeah, because you're right, Dawn, every day they're obsessed with that child. Poo, pee, vomiting, phlegm, and baby not sleeping, baby not enough milk. Actually, these are important goals. But antenatally, you got to mentally understand already and take it as it comes. But we are here to help you to make it better or improve. And that's why it's called medical support team. Right from your own gene, who is a major person to all of us to support you right through. So if the pediatrician or obstetrician are happy, so we will actually take on second role, like even feeding. We are the expert in feeding. Sleep training, I'm the expert in sleep training. All right, crying baby. So you picked up the 5S, which I share you with in the entity class to actually take you through as parenting. Don't always, one person's sharing is good, but it doesn't represent the world population. So a bit research-based and evidence-based.
Yeah, there are more ways than one to get there, right? Yeah, so I think a lot of people suffer from the lack of sleep issue, but Dr. Wong is also very good at helping to make it a lot easier for you guys and for your baby as well, because you talked so much about the stress part, right? So for the baby and for the parents as well. So it actually can be made a lot easier. You can actually find yourself sleeping a lot better just by learning the right things. So just now you mentioned so much about breastfeeding, right, Dr. Wong? But actually for there's so many questions, and it's like over 100 plus questions already, but you can all ask tomorrow as well, because there's actually a webinar tomorrow about breastfeeding. So if you haven't already registered for it, if that is something that you're very concerned about, tomorrow's webinar is actually about breastfeeding. So make sure that you're already registered for that. All right, so I think we'll talk a little bit more about the exercise part. Dr. Wong, somebody was asking, what kind of exercises or activities that you mentioned earlier, right, that can be done to reduce posture-related problems?
Yep, very important. Your posture is affected by your pregnancy. As you grow, the pregnancy advances, the relaxing hormone affects it, and the weight balancing as well. And because of this, in the class, we'll correct your posture. So learn to do daily activities in the right manner. Even sitting down in your office to do your work, it can affect your posture and lead to unnecessary aches and pain. Like muscle cramp, if you don't move around and your legs is all still, all right, not only during pregnancy, you're going to get swelling, retention of fluids, and you got spasm because the oxygen swelling take place, and then the relaxing hormone affect the vein valve, and they're unable to squeeze the blood back for interchange. So the blood there, oxygen supply is less. So you're going to spasm. It can be very painful, So
Yes.
that's why, these are stress, right?
Yeah.
Discomfort. And yet doctor said, "Bo pian lah. Do your exercise and then bring your legs up." Yes, because your obstetrician is more concerned about your baby and your well-being. These are very minor things. So that's why we are the persons that out to help you. Maybe use this technique. I even use acute pressure point. All right. And I also have a full cert in TCM for the acute pressure point. So I make use of that. So my late father was a very famous singer. So I married the East and the West together in my approach.
Oh, wow. Oh my gosh. I wish I knew you so much earlier.
So as I say, when you see my my resume, you got to be shocked, right? People, that's why I believe in learning.
Yeah. Yeah.
Even I got an early childhood education. So right from young, how you born with your baby are very important. So start off, that's why, BFJ say skin to skin when condition allow. Start bonding. And then before that, Papa, in the womb, you have to start using the 4 approaches. Learn to talk to the baby. Do you know that, Dawn? I often heard Papa, I ask questions. I say, how you talk to me? I say, hello, goo goo gaga. That's nonsense, actually. But we don't believe in baby talk. So use simple language and take to the father. So one take is that you say, how are you today? After you greet my mama, how's your day? Right? You talk to me. Then you reflect on oneself, say to the baby, Papa had a very busy day. Right? I have to go to bed now. All right? Have to say good night. Simple conversation like that. Be good to mommy. I'll see you in the morning. Have a good sleep. Simple. The baby is real. It's growing. Can hear you right from 15, 16 weeks onwards.
Their communication skills are already starting to be picked up at that time. So yeah, I don't baby talk my kids as well. So I think maybe that's why they are all chatterboxes now. But they but yeah, I think like you talked about exercise, you talked about breastfeeding and then watching your stress levels as well. But what about nutrition? So a lot of people, a lot of women are concerned about gestational diabetes. Actually, I had gestational diabetes with my first one, but that was because I just ate whatever I wanted. And then especially with durians. So I had gestational diabetes in my first one. Somebody was asking that, is there anything that you can do to prevent gestational diabetes? I think she's specifically asking for older women.
Older women. Actually, gestational diabetic means your insulin is insufficient to break the sugar down. So therefore, gestational diabetic, no need to worry too much. It's highly incidence if your father is a type 2 diabetic genetically. So the gestational diabetic, let us actually work together. And also the dietitian. We look at the diet control. All right. So we will cut out some of the accessory intake. So it's no need to worry too much. Very rare, mother need insulin control. So once the baby can grow quite big, so we have to measure. You've got to learn to measure your blood sugar level as well. And your doctor may be too concerned when the first time they may ask for the GTT test, the tolerance test. So there is a level doctor will share with you that you've got to be a bit careful about it. So we will introduce low glycemic index food. And you will no need to starve. Right. So we'll share with you exercise, also important, correct exercise, and daily, active, be active rather than stationary. All right. Don't worry and worry too much because baby can be very big. By 38 weeks, 39 weeks, I do know that by norm, the doctor will ask for induction because otherwise baby overdue. Like we allow baby, your doctor allow baby to go over 40 weeks, then your baby can be too big to come out. So you may have a higher risk of cesarean section. It's something, once the baby is born, gestational diabetic disappear by itself.
It's true. Yeah, because like I was sharing, my first one is I had gestational diabetes. My baby was 42 weeks and still didn't want to come out. And she's also the biggest, so I ended up with a C-section. So I think this preventing the GD in the first place is actually a very good thing already. Just prevent yourself from having all this trauma later.
Durian is very full of fat, sugar, protein. So enjoy it. As I say to mom, even breastfeeding, mom often asks me this question. If I eat durian, will have durian flavor milk. No, but when I analyze the breast milk, there's element of it. When you taste the breast milk, even after you eaten urine, you cannot taste the urine in that milk only. Only when analyze it, there is flavor inside there. So,
Wow.
Papa, I actually ask you to do a test.
Uh-huh.
Right? If mother enjoy durian a little bit is fine, but it is don't consume too much. You
Okay.
love durian, right?
I still do. It's I cannot. I have to stay away from Geylang when it's the season.
The best one. Yeah. A lot
Yeah.
of people enjoy that. Even my Canadian clients, patients, they love durian. I said, oh, put me to shame. Even up to today, I haven't mastered the acquired that taste for durian. So sad to say, tell you that.
Yeah. Oh
My
my.
house, no durian.
Oh no. So I
Friends
think.
coming to eat durian, eat in the garden
Oh dear.
before you
So
come in. Yeah, I have to acquire that taste. It's an acquired taste.
it is, it is. So we talk about weight, right? And the weight gain, but there are also people who lose weight. So I think there are two questions. Somebody was asking that if it's normal to gain 5 kg by week 9, she actually does exercise and she's under medication for hypothyroidism. So this is somebody who actually gained a lot of weight. She takes prednisolone also. So what can she do to slow down the weight gain?
Because why she's on prednisolone, she must have actually thyroid problems.
Hypothyroidism.
Because when you got medical condition, I think your actually doctor specialist will actually take care of you. And I suggest that, because my mother take prednisolone, it can affect the weight a little bit. So let's discuss and sit down because it's a specific problem. And then we actually see some of the exercise can help you to reduce some of the weight gain. Ideally, first trimester, I only encourage 1 to 2. Second trimester, only about 4 to 5. And then the last trimester is 4 to 6. Purely last trimester, your baby grow tremendously in height and in weight, right? If you attend my class, you understand, and because of that, indirectly, you beginning to lose weight. So first trimester, a lot of mothers don't gain a lot because they got vomiting effect as well, sometimes they got morning sickness. So again, I think this mother, we have to take aside, we have to ask and discuss, and then also discuss with your own specialist as well.
Yeah. So thank you so much, Dr. Wong. That was the person who actually is concerned about the weight gain. This person is concerned about the weight loss. She asked if is losing weight 3 to 4 kg in the first trimester. Is it common? Her intake of food is lesser because of nausea, and she's worried that she has less nutrients for her fetus. So is there any way to curb the nausea or morning sickness?
Very good question. Actually, some overweight, some underweight. I actually not concerned. So is your doctor. As long as the baby is growing well, you have reserve. What we call a reserve, and prenatal reserve. And once the reserve run out, of course we are concerned. But that reserve will last a couple of months yet. So again, first trimester, I'm not that concerned as long as baby is growing well inside and is healthy. So don't force yourself, but I suggest you take a little bit of a nutritious soup, packed with nutritions, and then brew some simple soup, not too diluted, small amount, high quality food, and appetizing. And don't take a lot of water with your meal because it makes your stomach swell and make you more nausea, especially indigestion. Don't take your bread with milk. And don't take your biscuit with beverage. I noticed that when mother got this bloat, you feel very bloated. After that, you don't feel like eating. And you can last for uncomfortable for hours. So you put mother off eating. As I say, do discuss, if doctor is not concerned, mom out there, I'm not concerned either. Just monitor. We don't want your weight to be dropped dangerously low. And at the same time, mother lost too much weight, it can actually affect the breastfeeding itself. So watch your diet, see what you are eating, come and discuss about it, and then why you're losing weight. So first discuss with your doctor first.
Yeah. Okay. Thank you, doctor. And then there was one part where you mentioned about, playing music, and then there's line during the Tai Jiao part that you were talking about. So somebody asked, what's a good way to expose the baby in the womb to music and light? And How close should this source be?
Yep. In the womb, there are two music. Internal is created by the mother herself. The echo of the voice, the heartbeat, and the guts movement and the blood flow. You create a very natural womb sound to nurture the baby 24 hours throughout the clock. Right? So that's why sometimes I say to mom, it's not necessary to buy the similar gadget, the similar sound to simulate that child. It's nature's way. Second, classical music. I actually found in the early days, there is few pieces of classical music, which is very slow and very soft and rhythmic. You only can fire off the myelination of the baby's brain of language, this language skill and the analysis skill. It's well known now, research has supported that theory. If you're able to listen 3 times a day and the soft music, classical, rhythmic, and never longer than 15 minutes per session, 1-5, your baby was born is super good in language and analysis skill. That's the research.
Start from the womb. I believe you. Yeah, everything is all you have all the credits at the bottom.
Always remember, try not to put loudspeaker on your abdomen because there is air pocket in the air. Even you watch F1, the air pocket will trap the decibel. So it comes to you no harm. If you put loudspeaker, next to your abdomen and play music, it can be intensified. Yeah. So the outcome may be a bit negative. So be sensible what we do and what we actually prepare for the pregnancy and prepare for the childbirth. At the same time, raise a brighter child.
Yes. Okay. So in the essence of time, we do have just enough time for one last question. Okay. So this kind of started the whole thing about pregnancy, right? So now we're going to end it. Somebody asked, with the sex part, okay, can I still have sex with my husband during early pregnancy, during the first trimester?
Well, you can, but as long as no medical indication. Some mother may have, doctor will tell you, first trimester 会动胎气. It means, but if you're healthy after sex, you don't have signs of early labor or tummy cramp or whatever signs of labor or irregular tightening, then or any spotting, then please continue, enjoy until baby is born. Late pregnancy, I will always say, encourage mom. You want an easy birth? Last trimester, 37 weeks onwards, frequent sex. Long walk.
Wow. Okay.
Play with nipple. Prepare your nipple for breastfeeding.
Yep.
It's a natural induction. Take home message.
Thank you for sharing that. That is so interesting. I should go and tell my pregnant friends.
So it's something that usually mothers don't like to ask. They feel very embarrassed.
Yes, that's true.
Normally they ask me quietly.
But I think it's something that's on a lot of people's minds. So first off, thank you so much, Dr. Wong, for answering all those burning questions. And secondly, thank you so much to everyone who put all your questions up as well. Now, don't worry if we didn't answer your questions, or Dr. Wong didn't answer your questions during this webinar. She will help to answer many of these questions where you can actually find the answers to on Singapore Parenting Festival's website. Okay, so make sure that you guys are going to the website to find those answers. So Dr. Wong, thank you so much. I've learned so much from you again. At this webinar, I kind of lost count how many times we've been together already, but each time I learned so much. So I'm really very grateful.
Thank you.
Thank you.
Thank you everyone out there for being so patient with me. Our last take-home message, we are out there just to support you and guide you and build up your confidence. Have a good pregnancy journey. And after delivery, enjoy your baby.
Yeah, thank you.
Bye-bye.
Yeah, you all know where to find Dr. Wong. One more time. It is wongbb.com.
Thanks.
I want to thank all these sponsors. Now, first, the Singapore Parenting Festival, in case you guys didn't know, is actually brought to you by MediaCorp and the Asian Parent, right? Now, we do have the Gold partners who made this possible as well. Sparkle Tots. So with those of you who are thinking about putting your kids into preschool, all right, these are our, there's PCS Sparkle Tots that you can look at. There's also Dumex, who is Dumex Do Grow, who is a Gold partner. We also have Scott's, and the content partners include Moms for Life, Dads for Life, Center for Fathering, as well as Hoya. Right. So again, we want to thank all of you for joining us today.